While mental health is a very complicated and often a very triggering issue for many, there are so many positives as to why to talk about mental health. The biggest is that mental health is a constantly changing scope. And because of this, there's going to be new data, new information that comes out about mental health. There's going to be programs that come out for specific demographics. And you want to keep up to date with that to not only avoid misinformation and bias, but to create meaningful change within your community and within other communities. Because let's face it, there's a lot of stigmas and there's a lot of myths within the mental health world. And it's important to tackle these and to tell people that, hey, these aren't right, these are not correct. There are a lot more complicated issues within the mental health world, and mental health is not just this black and white thing, it's very complex. So, what are the biggest issues of mental health and mental health systems specifically? The expense. It's incredibly expensive to afford these programs. It can be hundreds of dollars to thousands of dollars to just afford these programs. And because of that, a lot of Americans can't get these programs and can't get the help they want. And even if they do, it takes months to years to even get these programs. And the longer it takes, the less interested they're going to be. There's also the issue within social stigmas. So, social stigmas within minority groups such as Hispanics, Asians, African Americans, where mental health is seen as a sort of weakness, or it doesn't even exist at all, worst case scenario, or it's a religious phenomenon if you exist in a community that's very religious. Specifically, a lot of Christian communities and a lot of Catholic communities do believe this. And it's important to break down these stigmas, which is even more of a bigger reason as to why to talk about these issues. So, if there are so many issues within the mental health world, what is Obamacare and what is the added benefits and the cons of Obamacare? Well, before I begin, I'm in full support of Obamacare for many reasons, actually. The biggest reason is that if you are a dependent and you're already insured by your family, sorry, if you are a dependent and you're already insured by your parents, that essentially means that you can stay onto the program until you're 26. And with higher cost of living, and with inflation, it's more important than ever to save money. And then there's also the positive, because I have my notes here. There's also the positive of insurance companies cannot deny you if you have pre-existing conditions. So pre-existing conditions basically refers to conditions that you had before you went into the insurance program. So before, you would have to go into these programs if you already had the condition or the moment the condition occurs. But if you had it before, companies cannot discriminate against you. And then there's also the positive of that it covers in-network programs. So programs in your area, essentially. So it will reduce the cost of mammograms. It will reduce the cost of colonoscopies. It'll reduce the cost of maternity services. It will reduce the cost of childcare services. It's incredibly useful for those who cannot afford it, or even if you can afford it, it lowers the cost and at best, it makes it completely free. But there's also a lot of issues within it, which I understand why people may oppose Obamacare. The biggest one is that its insurance becomes much more expensive. With Obamacare offering so many programs, insurance are bumping up their prices. And with insurance being essentially mandatory with this policy in place, a lot of people are forced to still purchase expensive insurance plans, which is kind of like not hypocritical. It's kind of hypocritical, where you have this program that offers free to low cost services, but you're still paying for high services. And then another big issue is the out of network stuff. So the Obamacare program only covers in network programs, not out of network programs. So if your program is out of network, that means you're at best going to have to use a co-payment from your insurance plan. Basically, insurance pays part of the plan and then you pay the rest. Or you're paying completely out of pocket, which for many people, they cannot afford that, you know? And there was also this issue that was going on within the website itself, within the Obamacare website, where it was just too complicated to navigate through, which made signing into Obamacare pretty much impossible. It's been fixed from what I've seen that the site has been, it went under renovation, but it's still a big issue. So if you plan to try to go into the service, just a fair warning, it can be very complicated. But thankfully, there are tutorials online, and there's also on the website itself, it has videos on how to get into these services or how to sign up for these services. So, yeah, this is why I support Obamacare, and these are my main reasons as to why. Thank you.